Hello everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. In today's video, I am going to be covering one of your other clinical skills for NMC OSCE exam, and this time I will be talking about the wound assessment. Okay, so if you like my videos, please press the like button now and subscribe to my channel, and it gives me a lot of motivation to keep making more videos for you. Okay, so we're going to talk about the wound assessment station today, which is a 6-minute station in your exam. It normally comes with ANTT, so it's combined with ANTT. So wound assessment is 6 minutes, and then you go ahead and you change a dressing using aseptic non-touch technique, and that is normally 15 minutes. Okay, so 6 minutes and then is followed by ANTT technique. So today we're only going to talk about the wound assessment first. Okay, so I'm going to tell you how to assess a wound in your exam, what things to look for, what to verbalize after assessing, and then of course my top tips. Okay, so let's get started. So wound assessment in your NMC OSCE exam is 6-minute station. So you need to do a systematic wound assessment. You will be given a wound on the mannequin, or normally it's a picture. Okay, so you're given a picture of a wound, and you have to do your assessment looking at the picture, assuming that is the real wound. Okay, and they normally tell you all the pre-checks has been done. That means they tell you that you already done patient's ID check, allergy check, and all your equipment is clean, and so you can just go ahead and concentrate on assessing that wound. So you don't need to repeat the ID check and allergy check again. Okay, what we're going to do. So let's talk about it step by step. So next screen, so which is we're going to start the station the same way we do any station: scene safety, closing the curtain, cleaning our hand, and then we're going to explain what we're going to do to our patient about the wound assessment and gain consent, and check that your patient is comfortable. Okay, to start with, because we're going to be assessing their wound, we need to make sure that we do a pain assessment as well. So we're checking for comfort in the beginning, and then you're going to clean your hands, apply gloves and apron. Okay, so once you got your gloves and apron, then we're going to examine the wound systematically. So first thing, we're going to look for arrhythmia. Okay, so any redness, so we're looking for redness. Okay, so arrhythmia means redness, so we're looking for any redness on the wound or around the wound area. And second thing we should be looking for is inspect the surrounding skin for any swelling, because that will tell you if there is early signs of infection or there is a lot of inflammation. Okay, and the third thing we should be looking at, if you can tell from your picture of the wound, that if there is any exudate, any discharge. Can you see any discharge? Can you see the color? Is it green? Is it yellow? Is it clear? So we're going to look for the color. Okay, do you, from the picture, can you tell the quantity? Is a lot of discharge you can see, or is a little bit of discharge? So the color, the quantity, and of course you can't tell the smell from the picture. You can ask your assessor. Your assessor might answer that question if you really do want to. If you see a discharge in your picture and you comment on it, then you can ask the assessor if there is any smell to that discharge. Okay, and then we're going to go ahead, and then the fourth thing we're going to do is count the sutures. Okay, so if there is any sutures present in your picture on the wound, count them. Say how many sutures. Also check if they're all intact. None of the sutures have come out, none of the sutures look loose, so you do need to comment on that. And the last another thing you will do, next thing you will do is verbalize if your wound edges are together. Okay, so we call a floor of the wound. It means if your edges are together, or can you see any gaping. So if any of the sutures is loose or come out, you might see a little gaping in your wound, so just talk about that. And then you going to the last thing, you're going to check, of course, very important thing, if your patient is in any pain, or your patient is experiencing any tenderness. So that's really important that you finish with that. Of course you can't tell from the picture, so you will ask the mannequin, and your assessor will answer on the mannequin's behalf. So you do need to talk about the pain and tenderness. So once you have completed all that, so then you're going to go ahead on your next screen. You're going to verbalize the actions. Okay, so like I said, it's not just good enough to just do the wound assessment. We need to now take some actions depending on what answers you got from your wound assessment. Okay, so what did you find in your wound? So you will just verbalize your action depending on your assessment. It may be that you will verbalize that you need to take a wound swab if you did see any redness, any swelling, or any little bit of discharge on the wound. So you should take a wound swab. You should refer your patient to the medical team, and also depending on the result of the wound swab, you may have to refer your patient to tissue viability team. Okay, so you're going to verbalize that. You're going to also verbalize that you're going to document everything in your patient notes very clearly about your wound assessment, and then you're going to remove your gloves and apron and clean your hand, and of course that would be your final hand hygiene, and that would be the end of your station. Now the top tips. The first one, again, is a very quick station. It's a 6-minute station, so make sure you know how to do the systematic assessment, and you can use your time wisely. So practice it within that time period. So it's really important that you can finish this station in 6 minutes. And the second one is, like I already said, systematic approach. Do not forget any of the points which are within your marking criteria. You need to cover all those points in your comprehensive wound assessment. Third thing is verbalize everything very, very clearly. So your assessor, because it's more verbalization station, so your assessor can hear you clearly and they understand that you're doing a systematic wound assessment. So that's tip number 3. Tip number 4 is just making sure that you at the end you're verbalizing your actions as well. Okay, so that's really important that you are referring your patient to the medical team, and if there is any early signs of infection, you are talking about the wound death, you will take a wound swab and maybe possible referral to the tissue viability team. So that's really, really important. So you don't forget to verbalize your actions after you have done your wound assessment. So these were my top tips for this station. I hope you liked the video, and if you do like it, please press the like button and subscribe to my channel, and also you can visit us on OSCEnursetraining.com. I will soon be back with another video for you on one of the clinical skills again. Thank you for now.